Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Good afternoon, folks. This is Dr. Shailinder Sodhi along with my co-host, Dr. Anju Sodhi.
Good afternoon.
And today's topic we have is on the dietary fiber in health and disease. So, so many other topics which we have covered. Some of you have called us and asked us to cover the dietary fiber. And, I thought that was a great topic. So, in order to call us on the show, folks, you can call us at 1-844-301-1250. 1-844-301-1250, and that's the direct call to the studio, and we will be happy to talk to you. So today's topic is on the fibers. And also, before we start the topic, Dr. Anju, as we are doing a little bit of spring cleanse program at the clinic.
Yeah, it's the best time. Like the spring is here. We just had the spring has started, and we are doing a spring cleansing program at the office. If you are interested, you can call at the 425-453-8022 to get the more info about the spring cleansing.
Right. So the number to call for the spring cleanse program is at 425-453-8022. Again, 425-453-8022. This is a program which we do every year with our patient or the people who are interested in achieving a great health and doing a little bit spring detox. It's just like doing a home cleaning, like in the spring cleaning I call. So it's the best time to do a detox because, the body rejuvenates quite a bit during this time of the year. And we make much more cells in our body. So, and also, this is the best time that we can, do the complete detoxification with the improvement in dietary habits and doing a little bit of panchkarmas, which is a 5-step detox. So this program, the spring cleansing,
includes that. That's there would be a consultation with the doctor, and then the whole guidance will be given for the 21 days. And then there is a oleation, which is the internal oleation too, and then the massage and the sauna treatments and the shirodhara and also the colonic. So it's a great way to do the spring cleansing. It's a 21 days, and if you guys are interested, call at the office at 425-453-8022.
So anyway, also we are going to do another program in June, which is, remember there is International Yoga Day.
Yes.
And we have discussed at the clinic that we will be doing Yoga and Ayurveda Day. And the date for that is June 17th, for that, which is a Saturday. And it will be a half-day program where we will have some sessions for the yoga, and also there will be lectures on Ayurvedic topics, and free consults with the doctors as well. So anyway, that will be June 17th for Yoga International Day, which we will be celebrating, and so we'll be combining with Ayurveda. Anyway, so folks, to call to the studio is 1-844-301-1250. आप हमारे साथ हिंदी, उर्दू और पंजाबी में भी बात कर सकते हैं. बात करने के लिए आप हमें 1-844-301-1250 पर कॉल कर सकते हैं. एक बार दोबारा 1-844-301-1250. तो आज का जो टॉपिक है वो हम कर रहे हैं फाइबर्स पे, जो हमारे खाने में कितने फाइबर्स होने चाहिए और उनका हमारे ऊपर क्या इफ़ेक्ट है. तो द मेन टॉपिक इज डाइटरी फाइबर इन हेल्थ एंड डिजीज. डू यू नो डॉक्टर अंजू दैट द अमेरिकन डाइट, द एवरेज कंजम्पशन ऑफ फाइबर इन डेली इनटेक इज half of what is recommended by the RDS.
Yes.
That's the required daily allowance, and that is 15 gram. And that is a very low side, and majority of our American diet is much more rich in the diet which is very low in fiber, high in starches, and rich in meat and fats and sugars. So that is the one of the thing. And guess what? Who is the lower consumer of the fiber in sexes? Can you guess?
I should guess.
I think that tells you that the women are the lower consumer, and you did not want to say that.
You know,
wanted
but
me to say
also
that.
I like a lot of the teenagers these days. If I check at my home, I have to, I feel like they are not eating enough fiber. And even though you make them to eat, but like the overall, it has decreased a lot.
Right, and that's very interesting. You brought the teenagers, and also there was a study done on the teenage. Again, guess what? Who won in the fiber intake? Guys, the women's were again low on the fibers, and I start thinking, why is that? And the reason I think is basically women's usually attracted toward the much more of the starchy food, which are lower in fiber. I mean, you are an exception to the rule. I do not include you in that population. But the reality is the women and the girls performed poor in dietary intake, whereas guys had more. But guys didn't do any better either. They were still low as for the daily requirement of daily fibers which we need to have in our diet. So we are going to cover the fibers, which actually helps with the, in the health, as well as when you do not take enough of them, then they lead to diseases. So Dr. Anju, I'm going to let you take over on, at that part. Can you just pinpoint some of the diseases which are really caused by the lack of the dietary fibers in our diet on daily basis?
Yeah, definitely. So I will people may or may not know that so first of all, I will ask all of you to just think about how much dietary fiber you are taking in a day. So when I say the dietary fiber, maybe I want to explain it a little bit more. That the dietary fiber you will be getting from like the bran we use. Like in the old time, I remember my mom at the back home, they used to like not here anymore. We get the packaged flour and everything. But when we used to
much
get
more refined food,
much more refined.
Here.
And we used to have more bran in the wheat when we were growing up. And also, like, it was too much. Then my mom had to take some away, like that they will
use a filter system.
They will use the filter system and take. So now, if we think like that's the good part. Like, and I have grew up seeing my mom maybe taking the peel off of the apple and then just eat the apple. Okay,
right.
So that peel has the fiber in it.
Right.
Also, like there is like the fruits, people still there is a lot of people, they do not like to eat the peels.
Right. Interesting is that peels are not only rich in fiber, but they also contains lots of vitamins and mineral naturally containing, because that's the part of the structure of
And
the fruit.
pectin.
And the pectins, which is really
Which is
very
the water
healthy.
soluble.
Right, and that's the part of the water soluble fiber in it. So, now, folks, when we talk about the fibers and how they lead to the disease, which Dr. Anju will cover, but we have two types of fibers. One are the soluble fibers, and that's one of the example was the pectin, which we just talked about. And then there are also insoluble fibers, which are much more fibrous, which are fairly obvious. For example, if you eat fruit, or let's talk about the vegetables, it has lots of cellulose or hemicellulose, which are indigestible. They are not digested by the system, but they are important part of the digestive system in a way that they don't get digested, they don't get broken down, but the healthy bacteria, the acidophilus and bifidobacteriums and all those, they love to have those because they grow in that environment. So that's why the fibers are so important when we are discussing about the whole thing, the fiber. Initially I mentioned about the fibers we consume very little in our diet, in U.S. population, or in the Western diet, we can say. If we go back, few centuries ago, majority of the human population were gatherers and hunters. We did not have lots of processed food in our diet. So whatever we gathered, that's what we ate, and whatever we kind of hunted, that's what we ate. Right now, the way our life is, because of fast lifestyle, we are actually processing the food, and we are removing the nutrients out of it. Because
that is very much true.
And that's because we want to increase the shelf life of the food. So, also, we are also going after the taste. Sometimes people are kind of developing different taste buds. So we are getting away from the nature. So that's the part of the problem too, because our taste buds are changing, because we do not have all the nutrients available, which are the factors for achieving a great health. And a lot of these diseases which are caused by in today's society is because of the way we eat our food. So, anyway, so what are some of the examples, Dr. Anju?
Let's talk about some of the metabolic disorders or metabolic diseases, which is, so obesity is the one of the biggest one, people who are not eating the enough fiber in the diet and eating a lot of the processed food, lot of meat and starchy, so they are gaining weight. So obesity is one of them, and then there is some gout, like the arthritis. These are the other ones which will be due to the lack of the fiber in the diet, and also the kidney stones and the gallstones. People can make more if they are not eating enough fiber into the diet. And then if we go to your cholesterol, you can really decrease the cholesterol by eating more fiber too.
So that affects our cardiovascular health.
Affects our cardiovascular health. So that tells that fiber is very important for your cardiovascular health. And the hypertension. So all these are interconnected, and so the role of fiber is great into eliminating or decreasing some of these diseases. And also then other the thrombosis can be happen. That's all the circulatory system related. And then the biggest one is when with the lack of the fiber is from our gut. There is so much GI thing will be happening. Constipation is the one of the biggest one. When people are not eating enough fiber into the diet, they will be constipated.
Also, there are other diseases like irritable bowel,
diverticulosis, diverticulitis.
All these are related to poor the fiber intake in our...
Irritable bowel syndrome is getting very common these days, and the ulcerative colitis, where the people see the blood coming into the stool too. We see a lot of patients with these diseases too at our office too, and by changing the diet, by improving the diet, it really helps a lot too. And then there is some autoimmune diseases too, which can be secondary to the low fiber in the diet.
So they get triggered.
And so there's folks, there is so many things I think that has some sort of relation with the poor fiber into the diet.
So folks, we are talking about the dietary fiber in your health and disease, and in order to call us, we recommend you to call at 1-844-301-1250. Again, 1-844-301-1250. That's a direct line to our studios, and we'll be happy to talk about the dietary factors. So anyway, the one of the things which we have found, the amount of fiber is usually recommended in men's and women is two different recommendations. Usually, any men over age 51 or older, they need to have about 30 grams of the fiber, whereas the women can consume about 21 to 25 grams of the fibers. So, a younger population need to have more fibers, around 38 grams in daily intake, and women need to do about 25 grams in a fiber intake. So, that is the one way of doing it. And the best sources of fiber actually comes from the diet, what we really eat.
Yeah, and sometimes we do, like the people do supplement with and some of the diseases we have to supplement with the dietary fibers too. But sometimes there is it can affect the mineral absorption in the body with the added fiber, like the supplementation. But when you eat the fiber as a part of your food, like from the vegetables and the fruits and the bran, that should not, that
doesn't interfere because it actually is naturally mixed with the minerals.
Yes.
So it does. But whenever we put external only fiber alone, they can interfere with the, if you are supplementing with the multivitamin or other, sometimes that absorption may not happen. So that has to be carefully taken. And I usually recommend people who are consuming the fiber, then they need to separate it out from the supplementation. So I think that's what you are also indicating. So the other things, which we have found is that, by eating wholesome fruits, actually you can get all the nutrients along with the fiber, and that really these any vegetable source or fruit sources which have soluble fibers as well as insoluble fibers, they get taken up by the gut as it is. What happens is when we eat the fiber, first there is a transit time.
Yes.
Which actually get affected by the by consuming the fiber. And the folks, transit time means how the food travels once we eat, once we chew the food, and how it travels through the gut and up to the elimination time. So the average transit time in the US population is over 48 hours. In one study, actually, it was over 72 hours. So which is an indication of disease pattern that shows that very sluggish transit time of the food once you eat. In other part of the world, which in the third world, which we consider are the poor nations, those who can't have too much of processed food. So what these people do is actually whatever they grow in their field and what are they hunting, that's what they eat. Their transit time is less than 30 hours. So that tells you, how sick we have gotten when we have start processing our food in the developed nations, in US, where we get all these foods which are very, very low in the fiber. So, I definitely recommend people to go back to our roots. That means consume more of the wholesome veggies and wholesome beans and wholesome fruits, and less often meat product. The meat actually have taken over quite a bit in our food. And that's actually is a lack of fiber.
And then by eating more, it's more like the acid production too. So we do recommend if it's a good source of the protein too, but eating the lean meat or the fish is the better choices rather than eating the red meat.
Right.
And like if they eat and we do suggest at the office to our patients that decrease the amount of the meat consumption. It should not be every day.
Right.
And I have noticed our teenagers especially, they love to eat out and they love to go for the fast food places too, and that is just the meat and just the simple carbohydrate.
Right. And there is hardly any fiber.
There is hardly any fiber. So, which they really need to change. And then there is we are noticing the lot of the constipation, ulcerative colitis, or the irritable bowel syndrome associated with the teens.
Right. So, the one of the thing is, even when you mentioned about to have consumption of, the lean meat and fish, it should be combined with the complex carbohydrates.
And also the vegetables and the complex carbohydrates.
Right. So, the whole bran, like
Yes.
whole brown rice, or if you can handle wheat, then it should be full bran wheat, not the modified wheat where the bran is taken out. You don't want to go with the starch type of bread, or
and bran can be added into your flour too. Like these days, if when we go to buy say whole wheat flour, we say it doesn't really have the bran. And then you can also buy the bran separately, wheat bran, if you're making the wheat dough, and you can add the bran too.
Right. And again, folks, if you're sensitive to gluten or other, then the wheat is not, but then the other brands are available, like oats you can have. And the very good, one of my favorites are the amaranth, millet, and the quinoa. These are
whole
also
grain. Then these whole grains can be used.
Right. So, folks, we are going to take a very short break, and we are talking about the fibers in your disease and in your health. So, feel free to call us at 1-844-301-1250. Again, 1-844-301-1250.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
Good afternoon, folks, again, and thanks for joining us. And we are talking about the topic about dietary fiber in your health and disease. And, we have a caller on the line, so we will take the caller first. Caller, go ahead. This is Dr. Shailinder Sodhi on the show Your Body's Natural Pharmacy.
Hi, Dr. Shailinder and Dr. Anju. I had a question regarding fiber's role in weight loss. More so, if someone is trying to lose a few pounds, is it better to increase their fiber intake or decrease their fiber intake?
Okay, that's a very good question, and I was going to discuss this topic, and your call is very timely. And, actually the reality is there were studies done on the fiber intake and the weight loss. And for our, there were studies indicated the people who consumed more fiber on daily basis, they lost more weight. So, it's a natural way of body's way of causing a weight loss. It's a one way that body actually, how the metabolizes the other symptom. So, when you have a fiber, much more fiber in your diet, it also counts for the empty calories. That means you feel full much sooner compared to the processed food, which are, has more caloric value, but less fiber. So the body actually end up consuming more calories. When you consume more fiber, you are consuming less fiber, less calories, and that actually puts your body into the negative phase. That means your body wants to lose weight. So one of the studies which was indicated shown the people who consumed it was very small study on the 9 subjects with just taking a guar gum on a daily basis for 2 months alone, about 20 grams per day, and it showed about close to 9.5 pound weight loss in 2 months.
Wow.
So your question, how you do not want to consume less fiber. Actually, if anything, you want to have more fiber in your diet, and especially for those folks who, like Dr. Anju mentioned earlier, with the metabolic syndrome, these people definitely have to have enough fiber in your. So to answer your question is, yes, you need to increase more fiber, and that fiber need to come from the natural sources, from the plant-based fiber, and the beans have a lot. So if you just stick around and listen, we will be giving you more tips, which types of the beans have more fiber, what types of the plants have more fiber, and how you can really make your daily diet rich in fiber, which will not only make you healthy but also lead to the weight loss. So I thank you for calling, caller, and we will continue with our topic on the dietary fiber. So, Dr. Anju, that was a good call.
That was a very good question.
Yeah. To me, and the same studies when they conducted with the guar gum, which is fairly available, and, then they did this study on a 1 year basis based on about 20 grams of guar gum per day. They added to the food. And guess what? How much weight loss was happened? In 1 year, more than 60 pounds. And that's a very healthy weight loss in an individual who do need to have a weight loss. And I'm sure you have your patients who weigh more than 250 pounds and they are over 200 pounds. I have quite few of them. And my approach to these individuals is modifying their lifestyle, adding a little bit exercise, and I do add fiber in their diet. My fiber recommendations are very healthy. And these individuals, once they follow, they notice about weight loss of 5 pounds a month.
Yes, and it's a filling too. The people who feel that when they are eating and they do not feel satisfied, I do tell sometimes my patients to have some, of course, like the salad and the fruits, and before even they start eating the real meal, start with a lot of salad. And then sometimes I do tell my patients to just maybe have some psyllium husk.
Right. And that's the other type of fiber which should be taken away from the supplements, folks. Not to combine your multivitamin when you're taking psyllium husk. It should be taken totally separately. But it's a great fiber.
Yeah, it's a great fiber, and the people who has especially with the people with the heavy weight and they don't feel satisfied with the small portions.
Right.
Then it's become sometimes they feel satisfied that before. Even I tell them to take before, and then 15 minutes later they can have this. So my goal is they do not eat full meal.
Right.
They cut down their
the
meal
amount of
portion.
caloric intake will be less. So, this is a great study which, just showing how the fibers actually contribute to maintain your healthy weight. It's not that if somebody who doesn't need a weight loss, if they put it on fiber diet, they might not lose as much. They are not going to. It only happens with the individuals who are overweight and lack fiber in their diet. So, the body doesn't go into the negative side of the weight, weight. Otherwise, when you have lesser calories in your body actually wants to burn the fat other places where the weight is. So the fiber actually really helps to move the fat out of the system.
Yes.
So, the thing like you mentioned, maybe starting with a great healthy salad.
Yeah, that is actually great. And I do suggest, when I'm suggesting the healthy, and I do that at my home too, a big salad with the lot of greens and carrots are great, and cucumber, carrots, some tomatoes. It depends. Some people can have tomatoes, some can't. And then like I definitely like to add some like the fat, like I will add a avocado, or I will add like my dressings are only like the olive oil, fresh lemon juice, and a pinch of salt and black pepper. And I do like to put some of the nuts and seeds into my salad too. And that's really by eating that full plate of the salad before I start my real meal, really helpful.
Right. And the other good source of fiber is actually the beans.
Beans
Beans
yes.
contains more fiber than any other thing.
Yeah, and in the Indian population, we do, like, especially the vegetarians, they eat a lot of the beans.
Right. The beans alone, if we go by gram, they provide you more than 8% of the fiber. That's how rich the beans are. So consuming whole beans, we have beans which, some people kind of have crushed bean and they remove the coverings of the bean. And those actually, you are not only eliminating the B vitamins, but it also removes the fiber away, which is not really healthy. I know certain cookings do for the taste we do it, but the beans are basically have more complex carbohydrates and balance naturally with the protein and naturally containing the fats. And Dr. Anju, now we're going to have, fairly soon from next week, Navratris are starting.
Yeah, I wanted to add that too, because in the Navratri days, which is I think we are starting on the 28th, which is Tuesday.
Right.
And a lot of people, Indian population, they do the fasting, and it's the good way, they have
it's like a seasonal change.
Seasonal changes. You are away from eating the regular meals like the wheat, and only one thing which bothers me is because people eliminate the beans too, and then they end up eating lot of starchy food.
Right. So they have eliminated the grains. They have eliminated the beans. So now we are hooked
dairy,
up to
lot of dairy. People are eating lot of dairy.
Right.
And then they are eating lot of potatoes.
So which are rich in starches.
Which are rich in the starches.
And the funny part is that they peel the skin away.
They peel the skin away.
Which is again the whatever fiber we are going to get. And that is not even there.
That is not even there. So, we can just suggest, it's folks, then you need to figure out what would be the source of the protein during Navratri days.
And what are the source of the good fiber?
So what are the source of good fiber?
So, what we have done, even though by having 8 or 9 days of fast, which is a modified fast, we eliminated all the grains, we eliminated all the beans. But if we make sure that we have enough fiber, not only these are healthy fasting, and also, we will not have the sugar high. That means because this food is very much now
very
rich
much,
in
it's
sugar.
It's going to increase your sugar.
So the people think, all right, I'm doing a great fast. But the reality is you are actually hurting yourself.
So you can make it's a great way of, but you can make it your way too if you are not very strict traditional way. If you don't want to do that way, you can just suggestion is make smoothie in the morning instead of eating some fried fries in the morning,
right.
Potato fries, which people usually do, and making the smoothie, put a lot of greens and put fruits. Papaya is a great, lot of fiber, and then pineapple, apple, and then put some nuts and seeds. Make some soak some nuts and seeds, and you can add the chia seed, hemp seeds, or flax seeds too.
I'm a big fan of the flaxseed powder
for the fiber, and make a good smoothie because you're adding the nuts and seeds, so you are getting your protein, you are getting your fiber from the vegetables and fruits, and start your day with the good big glass of smoothie.
Right. And the one thing with the fiber intake is, folks, remember the hydration is a very important part of fibering. So when you're taking fibers, hydration is needed. So during the Navratri, I would recommend keep hydration up.
Keep hydration up.
And the hydration, what the best hydration is not only drinking water, but also coconut milk and coconut water is a good thing to have.
Yes. And then again, like our people love to, like, which is traditionally I used to do at my home too when I was with my mom, or like eat potatoes in the afternoon, potatoes in the evening. So you can really change. I don't know, some people are strict with the eating not some of the vegetables.
The other thing I was thinking, if you're going to eat potatoes, what about the yams and sweet potatoes?
Sweet potatoes and yam would be the better choice. And you
these
can
are
make
the good alternatives.
Yes, good alternatives. You can make. I do that. I make the yam fries or the sweet potatoes fries. I do.
And
not,
how do you make your fries? I want you to explain this.
I do not fry it. I just with the skin. I just make the
Actually, you bake it.
I bake it. I bake it in my oven, and I put some like coconut oil spray, or just a little bit of the coconut oil. I put that, and it turns out really good. It takes a little bit more time, but really good way to eat.
And the folks, the yams are naturally, they are rich source of all the different vitamins, beta carotenes and minerals, and even though they're sweet tasting, but their glycemic index is low, so that do not cause a spike in the sugar. As compared to the potatoes, when you peel off the skin and you eating, these are the potatoes actually causes a spike in the sugar content in your blood. So that's not really, and that's why people sometimes eat potatoes and they feel groggy after that, because all of a sudden when the sugar is too much, insulin is getting secreted, and we are and that bogs you down. Actually, you feel more fatigued and tired. So all of a sudden you're thinking, oh, I have not eaten all day and I eaten potato, now I feel more, but because probably of the fasting. But the reality is the other way around.
Yeah.
That the insulin has, pumped up too much, and, all of a sudden your sugar is getting broken down, and you're getting digested quickly. So that's what happens with the refined starches. So when you have complex food, it not only gives you satiety, but it also slowly releases into the system, which actually does not cause you quick spike in the sugar and quick drop, but actually it will steady sugar intake in the body throughout the day. So so what other things you recommend in the Navratri?
So the other thing is, like, people eat like the gluten-free flour, like the kuttu flour roti, and the amaranth is great, which is really my favorite, amaranth flour, which is great. And you make it with the instead of adding the potatoes into your dough, I will suggest you that you put more other vegetables, like you can put the some greens in it, you can put some radishes in it, and which would be better way, and the ginger, and then that is great. But then instead of making only the aloo sabji, there is other sabji too, which you can make. Like I make I eat all the vegetables during Navratris. Some people I know that they are some restricted vegetables. They don't eat the some of the vegetables, but I'm not sure which ones are those. But you can make other vegetables instead of making aloo potato sabji all the time.
So, it could be. There's nothing wrong with the potatoes, folks, as long you have the skin on it.
But and maybe not like all the meals, with
right.
all the meals.
So, what happens is with the Navratris, which I notice is a lot of people are really just hooked up on the potatoes.
Yes.
Then that's not the healthy. The way the traditional system should be, that we need to make sure that we have enough fiber, and it should be balanced out with some level of proteins in the diet. So that's only best way, and that would be coming from the nuts and seeds.
Nuts and seeds, yes.
Like Dr. Anju mentioned earlier. So making a smoothie and getting the fiber in it. So
and the soups are the other way too. Like they can make like all the carrots and the tomatoes and the other vegetables, some of the other vegetables too, and they can make the soup. You do use the quinoa during my, and that is gluten free too. So which I think is okay to use during the fasting too. But so these are some like the suggestions I wanted to add.
Yeah. So one of the things I want to tell our folks, those who probably love potatoes, when you eat potato with the skin, the amount of fiber you get about 2.5 gram in 100 grams. So when you peel off the skin on the potatoes, you only left with about 1.4 gram So that's almost half of the fiber intake. So if you really hooked up to the potatoes,
Yeah, buy organic potatoes and then eat the skin.
along with it, at least you will still get, though it's not very high when we compare with the baked beans, which gives you about 8.8 grams of fiber.
Wow,
compared
that's really good.
and that's healthy.
Yeah,
that's
that's
healthy.
healthy.
So anyway, we will take a short break again, and we'll be back again, and we're talking about dietary fiber in health and disease. And the number to call here is 1-844-301-1250. Again, 1-844-301-1250. Thank you.
If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
Thank you, folks. This is Dr. Shailinder Sodhi along with my co-host Dr. Anju Sodhi, and today's topic we are discussing about the dietary fiber in health and disease. So, some of the dietary fiber, like we mentioned earlier, were soluble and water soluble. And I want to bring that into the picture. When we talk about the dietary fiber, like fruits and vegetables provide us cellulose, hemicellulose, lignins, pectins, and also there are waxes, the gums type of things in it. And the grains also give us cellulose, hemicellulose, and along with the lignins, they also contain phenolic esters, which are really healthy when you eat as a whole. About the grains. And the seeds actually really are the best thing to have. The like sunflower seeds or pumpkin seeds or sesame seeds. They contain cellulose, hemicellulose, pectin substances, and endosperm, guar endosperm, which is actually much better. Remember I was telling about the study when they conducted with the guar gum and trying to how much weight loss we had. So that's naturally contained. So if you consume particular amount of seeds every day, this can help not only giving you good fats in the system, but help in the weight loss as well. And this is what we need to. One of the things I think during break, Dr. Anju was mentioned about that I should bring it the transit time. How that improves with the fiber. So, folks, like I mentioned, that average transit time. That means once we eat the food, we chew the food, and the eliminate time in the U.S. population is 48 hours to the 72 hours. Compared to the rest of the world, which is less than 30 hours. So if we add this fiber in our food, or eating healthy salads, having along with the good, the flaxseed powder or other nuts and seeds, that actually gives the more body to the food. And not only you're consuming less calories, but it will improve the transit time.
Yes.
And what it actually does it, during that phase, it also causes the detoxification because the bile acids from the gallbladder, we all know our gallbladder sits and stores all the bile. That actually also get eliminated properly. And the majority of bile acids which get eliminated is through the having proper bowel movements. People who develop gallstones, and eating poorly, is because their bile is not excreted out naturally through the gallbladder. So, all those listeners, those who are listening to this show, if you know someone who has a gallstone and all that, they will be highly benefited by increasing the dietary fiber in their in the food. because it will help to get the bile secreted out of the gallbladder. And what that happens is then we make new bile acids, so the dilution start happening. So rather than the concentrated bile, which converts into the gallstone later on, actually improves.
Yes.
So that's how the gallstones improves, in the body. So having that really helps. So making sure eating pectins from the fruit, like apples are great, pears are great, other fruits.
And with the skin.
And with the skin, of course. That's always is the part, because you're also getting lots of B vitamins with the skin as well. So that really helps. So, I definitely recommend the people who are also having other chronic diseases like cardiovascular diseases, and you mentioned about the gout and all that, how important that is, that they need to increase the fiber in their diet. So eating...
Also for the cancer prevention, we need to bring that too.
Right. Exactly. Because, how the body, eliminates, detoxifies, and how it fights against the cancer cell. It is not, now there are studies indicating the diets which are rich in high fibers and good fiber really actually has an anti-cancer properties. So along with eating foods like which are rich in the beta carotenes, minerals, and vitamin C natural sources, these are all have that properties which really not only enhances your immune system but fights, has an anti-tumor activities too. So rather than eating much more diet which has more red meat or less fiber, this is one of the things which I would recommend. So my point is, if somebody comes to me for a weight loss, my goal is how I'm going to increase the fiber in their daily life. So there's like a good studies which I mentioned earlier. When you have good fiber going on, only about 20 to 30 grams a day, you can have a great weight loss in that individual over the 2 month frame. And these are the individual who did not modify anything else but added the fiber. Because when you eat the fiber, you are not going to eat much more of the much more of the starchy food, or the caloric intake will be less. So when you have less caloric intake, the chances of your body to do the healing process is better. So, we have another call, and I'll be happy to take that call. Caller, go ahead. This is Dr. Shailinder on the show Your Body is Your Natural Pharmacy.
Hello, Dr. Shailinder. This is Kunal.
Yes, Kunal. How are you?
I'm good. How are you?
Good. Okay, so go ahead. What is your question?
So my question on dietary fiber will be a role in losing weight and all. How can I practice it, like with my daily fibers taken and all?
Okay, so Kunal, the way we recommend is that you should increase daily fiber to about 20 to 30 grams a day. In the men, the fiber intake needs to be higher. So, so especially in early age, in the teenage, you need to make sure your fiber intake is higher than the non-fiber. So, eating more wholesome foods, like one of the example is, beans, like pinto beans, navy beans, the garbanzo beans, black beans, mung beans, lentils. All these have a very high source of water-soluble and not-soluble fibers in it, non-soluble fibers. So, if you're really going to do a weight loss, my suggestion is, having a big green leafy salad, like Dr. Anju mentioned earlier. And Dr. Anju was saying you can add a little bit of the sunflower seeds or other seeds into it, along with maybe squeeze a little bit lemon juice to it. Do not add any other type of calories. The fatty dressings are not recommended on that. So do that, big salad. And after the big salad, maybe have a bowl of soup, the bean soup. The lentil soup, the dal.
Soups are great too. Like we can put a lot of vegetables in it too, and you can then it would be like the protein too, the fiber too, just make that you need to cut down the calories and you need to increase. You can really cut down the calories by having more soup type of stuff, like you have maybe more like the psyllium husk into the yogurt or something,
or the flaxseed powder.
or the flaxseed powder, into some mix in the smoothie or something, and have that would be more filling to you, and then you will be able to eat less food, less portion size.
So Kunal, one of the example I give to patient who walk in, I tell them how if you can consume a big plate of the salad, that will give you lots of fiber, but also the only caloric intake is like if you take a pound or 1 pound of a salad, your caloric intake is less than 150 calories. Compare that to 1 full plate of rice and or any of your meat dish or anything, that will go close to 1000. So see how your caloric values are less. So that is the reason how you want to do your diet. So
and Kunal, you need to drink a lot of water. If you increase your fiber, I want to tell my listeners that when you are having more fiber into the diet, you need to drink a lot of water too.
Right. So I would suggest you doing all this and make sure you walk every day and hydrate. So that's a good question, and keep listening to the show. So some of the beneficial effects of the dietary fiber is like it helps with the transit time. Other is also delaying the gastric emptying, which actually reduce the postprandial hyperglycemia. Postprandial means when we eat the food and the sugar goes up. So actually when you have eaten fiber, that actually decreases, and it also make you satisfied more. Other thing which it helps to increase the pancreatic secretion, which are actually really important. Enzymes, lipase, insulin, and all those things comes out of it. Also gives the body to the stool, so that means you will not develop any hemorrhoids or anything like that. And also the best benefit which you get with the fiber is that it helps to increase the microflora in the intestine. And also the short chain fatty acids get increased, which are really important for a lot of our the enzymatic pathways, and it helps to increase the butyric acids, which are taken up by all those microflora in the gut. That's the food for them.
Yes.
And increases your immune system. And also the best thing is it increases your cholesterol. It reduces the serum lipids.
Yeah, and it increases your good cholesterols and decreases
The
your
bad
cholesterol.
And usually those are called low density lipids, or the LDLs. So and also our biles in the gallbladder becomes more soluble, so that also cuts down the the chances of getting a gallstone. So if you look into the populations, women develop more gallstones. So it's actually really important for the women to consume more fiber in their diet. So as we're coming to the last couple minutes of the show, some of the things which Dr. Anju we doing at the clinic is a spring cleanse. I think I want to bring that, and we are emphasizing on how to incorporate the dietary fiber during the spring cleanse. So that's important. Along with this time, you can also do modified fasting. But again, like Dr. Anju, you mentioned that we don't want to do too many starches, but include...
Yeah, and it's definitely like this is the good way we can wear this Navratri. It's very good to people who fast a whole 9 days. But please eat like a lot of fiber and drink a lot of water. Hydration is very important.
And the fruits like apples, which gives you much higher fiber with the skin. Mm-hmm. So, always remember the eating fruit with the skin is good. Even when you eat pear with the skin, they kind of matches close to the apples. So always don't throw away the skin.
Don't throw away the skin wherever you can eat the skin. I'm not saying that eat the banana skin, but definitely the apple.
And like Brussels sprouts and
Brussels
broccoli,
sprouts has a lot of fiber in it too.
And cauliflowers these do, and the cabbage has a lot of fiber. So these type of fruits really, and the veggies are very helpful in consuming. So anyway, folks, I hope you all have enjoyed listening to today's show, the role of fiber. And I, along with Dr. Anju, practices at Ayurvedic Naturopathic Medical Clinic in Bellevue. We've been there for over 25 years, and we have lots of clients who come for all the different issues. Fibers really are very beneficial in cutting down the chronic diseases. If you know, or if you have, or if you know someone who can be benefited, advise them to make an appointment with us at our clinic at 425-453-8022. Again, that number is 425-453-8022. And we give you lifestyle guidance, and we also do the basic metabolic profiles, and we do what the primary care physician needs to do, but along with the proper guidance in the dietary modification, exercise, and teaching you how to do the different yoga exercises and breathing exercises. All those are very, very beneficial.
Very important.
And remember, keep your hydration and be happy and enjoy your day to the fullest. And we love to hear from you. We'll talk to you next week.